Hello, my name is Kevin McNamara and I'm the Chief Executive of the Great Western Hospitals NHS Foundation Trust. And I wanted to provide you with a short update on where we are with demand for our services at this time. Our urgent and emergency care services are currently the busiest we have ever been. And we are seeing around 400 people arriving to the urgent treatment centre or emergency department every day. In June, we saw nearly 11,000 people compared to 9,000 in June 2019 before the pandemic. Coupled with an increase in COVID-19 patients and many staff needing to isolate or off sick, our services are facing extreme pressure right across the organisation. People arriving to hospital are often waiting a long time to be seen, whilst our staff work to treat those in clinical priority. I'm sorry if you've had to wait a long time, but this does reflect how busy we currently are. Of the high numbers attending every day, around 150 patients will need further care on our ward, and this puts demand on our inpatient areas, which are already struggling with reduced bed capacity due to the continued need for social distancing in healthcare settings. Of those coming to the urgent treatment centre, we know that some people could have received care in another healthcare setting, such as a pharmacy. And I will continue to urge people to think first about whether hospital is the right place for you. If you're unsure about what to do, visit 111.nhs.uk or call 111 in the first instance. We've also experienced a steady increase in the numbers of patients needing treatment for COVID-19 and expect this number will only continue to rise for the time being. For example, today we have 24 patients with COVID under our care, when just over a week ago it was 12. This will mean pressure on our services, but unlike the first wave, we are doing all we can to ensure that all services continue to run, and we will not postpone or cancel any treatment unless we really have to. Our programme to reduce our waiting list caused by the pandemic is well underway. Back in February, we had just under 2,000 patients who had been waiting for more than a year for treatment, and I'm pleased that we've been able to reduce that number to 985 patients. That's still too many people who've been waiting too long though, and we're absolutely committed to see everyone as quickly and as safely as we can. My thanks go to the incredible efforts of staff to treat these patients. I would urge you to take your appointment when it's offered, or let us know if you can attend so we can give your appointment to someone else. You can help by considering what you can do to help slow the spread of infection so that we can reduce the number of COVID patients needing hospital treatment. This includes maintaining social distancing and wearing a face mask in enclosed public areas. We are also asking people, unless they are exempt, to wear a face mask in all our healthcare settings, in the hospital, in our GP practices, and to follow the one-way system and maintain a 2-metre distance. This will help us keep COVID under control and ensure we are protecting our patients, staff and visitors. Our COVID vaccination programme continues at pace, and we've already given over 80,000 doses of the jab to local people. If you haven't yet booked your vaccination, please do so as soon as you can. The juggling act of managing COVID, treating record numbers of urgent patients and bringing the waiting list backlog down makes this phase of the pandemic its most challenging, and our staff will continue to be here for you.